Oh, Gene.
Hi, Joe. Hello, everyone.
How are we doing today?
Good, good. Nice picture, Charlie,
Oh, yeah, thanks.
with the mask and all.
I think I still smell like fish and chips.
Do you? Okay, it's 4:30, so we'll begin. This initial meeting will be for the explanation of where we are with the COVID restrictions, vaccines, and elsewhere. So, Joe, if you'd like to give us
Sure.
an update, please.
Sure. Thank you, Gene. Good evening, council members and others. I think one of the things I wanted to start out with today is maybe something that I had mentioned often early on is that, it's somewhat important if you want to get the latest news to tune into the press conferences that the governor holds, because today's press conference is more information than I could even hope to give you in this half hour that we have. And it was some good information about Newport generally. And I thought some interesting information otherwise. Newport reported case count, new case count was reported as 41 new cases. That's down from 54. So if you look at the weeks prior there too, we're hovering around that, I'll say the 35 to 50 range on average. Middletown had 23 new cases reported. They were 13 the week before. I think for the most part, it's consistent with Dr. Scott's comments today at the press conference that the data has plateaued in the state. It's stable, but we're not seeing the sharp decreases that we've been experiencing of late in terms of the case count. We're holding steady at how the state calculates positivity at 2%. There's been a slight increase in week-over-week hospitalization admissions. And Dr. Scott indicated that they're keeping an eye on some communities, Cranston, Cumberland, Woonsocket, South Kingstown, and Narragansett. They're watching their case counts slowly. Dr. Scott did emphasize that they're still looking closely at the variant, the UK variant, which is here in Rhode Island. It's obviously what you've all read, more contagious than the standard variant that we're all, I guess, used to, if that's the way to frame it. And she indicated it's what you all already know, what I've been indicating to you, that we all remain vigilant. I thought her comments actually on masks were kind of interesting, and that, as she said, the rule in Rhode Island, whenever you're with people outside of your household, wear your mask. I see that somewhat slightly more aggressive than at least the CDC guidelines on mask wearing that we had a slight discussion about last week. But that's how Rhode Island is approaching it, and it's a great approach to drive this thing down. She emphasized about testing, which is kind of, I think in a lot of people's minds, has kind of gone into the back of their mind, and for obvious reasons, but she just emphasized everyone to get tested regularly. She also emphasized treatment if you're 65 and older, the availability of treatment, and she also emphasized the obvious, vaccinations. On the vaccination front, the supply is a little bit down right now, but what I took out of the press conference is that the supply will climb back up in a couple of weeks, with at least a projection that on or about April 19th, the eligibility will drop to those 6 years and above. It doesn't necessarily mean you're going to get an appointment, obviously, but at least they're trying to project a more robust vaccine rollout such that they can drop the age grouping down to the eligibility down to the age of 16. Those of us who are 60 and older, if you haven't been vaccinated yet, it's very, very difficult to get an appointment, if not near impossible right now. But so at least the message from the state today, from the press conference, was stay tuned, that there will be, things will be much more robust in the next couple of weeks. I did note that they mentioned there was going to be 1,500 appointments added to the state vaccine sites. I checked that an hour ago. It didn't look like those had been added yet, and that there would be another, I think, 3,000 plus added tomorrow to the state vaccine site. So we'll see what develops in the next couple of weeks. It appears that the next couple of weeks are going to be somewhat crucial in terms of supply. And then hopefully, from what I took out of the press conference, is that 2 weeks hence, 3 weeks hence, there'll be a lot of vaccine out there such that they can drop that eligibility criteria. I would note the one thing that did come to the press conference is that it did seem that the governor was optimistic that there was a great chance that music would return to Newport this summer in the form of the jazz festivals and the folk festival, and that the state is working with the promoters to try to mature the circumstances of those performances in late July. That's good news for all of us, and I'm sure you're already all aware of it and have read about it. That's about all I really have to add today, other than, I did print out, there's always an issue about the homebound, and which, to me, at least, we've been asking that question even before it kind of got to be a real robust discussion about it. But there's right now, the state has contracted with those who can't get vaccinated through home health agencies. The state has made arrangements with 3 entities to perform those services. But the key is getting the information for those homebound who otherwise can't get to a vaccine site or are not getting vaccinated through a home health agency. Get that information to the state, and so that they can sign up and so that the state knows about their difficulty in getting vaccinated. And I gave you that information a couple of times since we last spoke. It's through a portal that the state has designed, an online portal, as well as a phone number that they can call to get them to sign up as a homebound resident. I can give you that information again if you'd like. Let me give you the phone number actually again. If you call 401-462-4444, they'll give you help with filling out the information that you need to fill out so that you can get on the list for vaccinations as a homebound resident.
Joe, I've had some success with visiting nurses.
Right.
Number of homebound people have called, and
Yes.
all I need to do is give them the name, the phone number, and the address, and they take it from there.
Well, that's great. I mean,
I just thought
I'm going to assume in those instances that they are somehow
connected.
Patients of the visiting nurses, and obviously the visiting nurses has cuts a very wide swath here on the island.
Yeah. The other thing is, I want to know, when you're talking about the state receiving an additional 3,000 and 1,000, are you talking the whole state? Are you talking?
No, that's the whole state, not Quinnipiac Island, the whole state. The supply is not robust right now, and it's not, and which is obviously evident if you go on the CVS website, fully booked. You go on the Walgreens website, fully booked. You go on any of the mass vaccine clinics, which are Cranston,
right,
Providence, and Benny's, fully booked. You can't get anything. So that's what I mean. These are just, and that's so they announced 1,500 appointments that they'll release today. Those will go just like that. You know, if you can hear my fingers snapping, which I know you can't. And then the 3,000 tomorrow, it'll go just like that.
Right.
But I think the point is they're and I say this in a good way, teasing availability of vaccines with the promise that, again, eligibility will dip to around or about April 19th, will dip to 16. And they're able to do that because they anticipate a very robust supply leaking into Rhode Island.
Mm-hmm.
And they'll also, so part of the idea here is that the state, if you will, is also considering and ramping up other mass vaccination sites. One in Woonsocket, one in South County, and then 3 sites supported by cities and towns, one in Westerly, one in East Providence, and another one in Northwest Rhode Island. They haven't identified the town. But also I'm sure you all read today that selected Stop and Shops will be, that have pharmacies and I think there's 3 of them, that will have vaccines available. Walmart, they haven't named the sites yet, but will have vaccines available. Incidentally, the Stop and Shop, the 3 sites that were named in the article that I read today was online. I think East Providence was a Stop and Shop site, might be Woonsocket and one other community. It was not Newport. It was not the Newport Stop and Shops. Walmart, again, they haven't defined. I didn't see any definition in terms of the locations just yet. That may have changed in the last hour or so, that considering how quickly this information changes. So it's just something to keep an eye out for. Again, I think we still have Newport Hospital. Go on the Newport Hospital website, try to book an appointment. Same issue in terms of availability, but you can go on their website. You can go on their, I'll call it their callback list. That is, at the end of the day, if they have extra doses, you can go on a list, and they'll call you up, and if you can get there within X number of minutes, they'll dose you. Yeah, so CVS and Walgreens, and those are all the sites. So things, at least I thought today was a good press conference by the governor. Things seem to be at least well planned and starting to move along. But things are a little flat this week. They'll be flat next week, and then we'll see. Hopefully, 3 weeks time, things will be rolling along on the vaccine front pretty aggressively.
Okay, do any council members have a question? Please raise your right hand. I don't think anybody. Oh, yes, Councilor Bova.
Hi, thank you. Just a quick question, and I meant to call you about this today, Joe, and the day just got by me.
Sure.
I had a resident asking about the status of the basketball hoops, and I know that you're on it, but I told her I would bring it up today. So
yeah, most of them are up. I know Angela asked me about the hoops in back of Coxhill. We're putting those up. There may be a couple of errant ones that aren't up yet. If you want to tell me where they are, I'll find out why they're not up.
Coxhill was the ones who were
Joe, can I just suggest, this is a COVID meeting and this wasn't advertised. Can we keep this, or you have an offline conversation?
Sure. I'm going to shoot. I got a shot at the basketball, so I guess it is COVID related. It's a joke. But
Yeah.
the Coxhill's, it's in the works, Jamie
Thank you.
and Angela.
Yes. Councilor Forte?
Joe, yeah, also Braga Park was brought up.
They're not up yet.
Park has hoops?
I don't know. I thought they were. I'll check on that.
All right.
The ones that Martin Luther King are up. I know that. I saw a kid walking with a basketball and I was like, what's he doing? And then I noticed the hoops were up, so.
Yeah.
Good.
Okay, any other questions? Yes,
Just,
Councilor.
I just think that during this time that there's sort of a lull in the vaccination supply, I'm just wondering how the city could get information out to people who might be resistant to getting the vaccine. I know that Jean and I spoke about, possibly getting information out to the Spanish-speaking community, and I talked with Elizabeth also about it. That maybe we need some flyers or something. I'm sure the state must have, right? So, is there a way that we could get a bunch of those to get to?
Well, the answer is yes. Every household would have got today, and has been getting
I got one.
these very large flyers, which English on the front,
Spanish.
Spanish on the back.
Mhm.
And I've been getting these regularly. We can reproduce these if people want to go hand them out somewhere. That's easy enough to do. I reproduced some information for Jean the other day relative to that. I think the information, well, I can't speak for the community. I think the information is, at least the efforts are being made. Now, whether it's getting to where it should be getting to, that's another issue. I'm willing to stand on a street corner and hand these things out if that's what it takes. But I guess I'll leave it to you that are more familiar with the issue. I think there's plenty of information out there. Now, whether it's getting there, that's another issue.
What Joe is mentioning, he was kind enough to do the brochures in Spanish and Portuguese. And St. Joseph's Church, that has a 6:30 Mass, has 150 families there. And Father Pont was ecstatic about receiving these. And it's a very easy flyer for them to understand. And when they make the phone call, every person that answers that phone, it's in Spanish. So they're feeling comfortable enough. Yeah. And also dropped off some to Father Frank at Jesus Savior in Portuguese. Yes, Elizabeth and then Angela.
Angela, go ahead. Your hand was up prior to me.
Oh, I'm sorry. Okay.
I'm like, come on. No, I'm just kidding. I do want to recognize too, by the way, so there are some nonprofits on the island as well, Newport County Mental Health, as well as Child and Family and EBCAP and a few other organizations, and my apologies that I can't remember all of them, but they have formed a communications coalition that specifically targets minority communities and also overall anyone who is struggling or trying to figure out or decide whether or not they should take the vaccination. They are specifically creating a strategy. So I'm
on that panel, Angela. I'm on that group.
Oh, okay. I went there the other week.
Yes.
Yeah, go ahead.
I'm part of that group. I volunteer on behalf of the city, on your behalf. And I met with them last week, and they are coming up with a very solid communication plan to what the group is. That's going to be, I think I have a call maybe sometime early next week, at least to better understand the communication plan, as well as the target communities. So I can roll some more information out to you after that, after I attend that next meeting. It's organized, Jamie Lahane, Newport County Mental Health, and others. Yeah, it's a nice group, and we had a nice first discussion. And so I'll roll some information out to you in the next week, hopefully.
And
Okay.
also there will be information given to the Chamber of Commerce, in particular for restaurants and hotels in both Spanish and Portuguese. Wait a minute, I know. Councilor Segley, you've got your hand up.
But didn't Councilor Fuerte want to go?
I don't know, she took her hand down.
Oh,
Councilor?
go ahead, Elizabeth.
Elizabeth, unmute yourself.
Sorry. I've been working with Conexión Latina Newport and the Department of Health to see if we can do an informational session strictly in Spanish in conjunction with Newport Public Schools as well. So if anyone wants to connect with Conexión Latina, I think they've been contacting the Department of Health to see how we can have sort of like a question answer type of session. So, so that they can minimize the fear about the vaccine and the other pros to respond to that. So
Just in follow up to that, in follow up to that, Elizabeth, I'll just say at the press conference today, Dr. Scott did indicate that the state is aggressively pursuing a program of access and equity with major focus areas, kind of narrow the disparities of vaccine distribution, and that the state is working with a lot of groups throughout the state. I hope it's all, you know, it's interesting. I hope it's all a unified effort as opposed to this disparate groups all working on different things, because, you know, that's one of the state's major focuses as well.
Councilor McCalla, did you have another question? No? Okay. Councilor Segley?
Yes, thank you. I was invited to sit in on a meeting with Dr. Chan from, and he was saying, and I think maybe one of the things that's scaring some people off is thinking that they might have to present an ID when they get a vaccine, but that's not the case. That you know, that IDs are not required to get the vaccine. So I just want to put that out there.
Thank you. Is there any other questions of the manager? Mr. Nicholson, do you have anything to add?
No, I'm actually provided the information that I wanted to provide today. Again, I think it's very important if you really want to get real-time information and good information is to tune into the press conference that the governor is attending to. I thought that today's was a very good press conference in terms of being very informative with the governor, with Dr. Scott, with Tom McCarthy, who was heading up the vaccine logistics effort, and a lot of information came out of that press conference. And so I was very impressed, actually.
Okay. Well, if that's it, we have a few minutes before our next meeting at 5 o'clock. So if you want to take a break, get a cup of coffee, tea, please, coffee or tea. And we'll have the meeting at 5. Thank you.